All right, this is Unit 3, Drug Therapy and Dosage Calculation. These are your objectives and these are your reading assignments. Let's talk about drug therapy and dosage calculation. So what are the challenges when it comes to effective therapy? Mainly, it's consumer awareness, right? Especially nowadays, there's so many drugs in the commercials, and you'll see so many patients basically going to their own doctor and asking for specific drugs. And we also know that that's not always applicable for them, and sometimes it's not necessarily the drug that will work for them. But I guess there's an advantage, a disadvantage to being more aware of what products are out there, what kind of treatments are out there for their disease processes. So again, consider the media, the internet. Now everyone can Google everything. And so this is where we have to step in as nurses and really educate our patient that not everything that they see on media is actually correct. That being said, there are some patients who actually benefit from it because there are times that, some providers they don't really consider certain drugs, but because the patients are more aware and they actually ask for it, they sometimes get that treatment. So again, it is really dependent on the patient. So this is actually an advantage and a disadvantage for this patient. When it comes to over-the-counter drugs, so this type of medication, you don't really need an order for it, so there's no need for prescription. So basically, they can get it over the counter. Now, in the inpatient setting, though, that's different. So, although in the outpatient setting, they can just get it over the counter, basically go to their local pharmacy and get that medication. Inpatient, because usually the reason why they're admitted to the hospital is because there's something acutely going on with them. So, they're quite sick, right? They should be sick enough to be in the hospital. Because of their condition and because we're giving them so many other medications, right? We don't want them to be just taking a medication from their purse or a pill that maybe their family brought it to them. And so in the inpatient setting, there is an exception. They can't just take whatever they take over the counter. It needs to go through the doctor, and the doctor or provider should approve it. So they should have an order to continue taking that medication, even though in the outpatient setting, it was a medication that they were taking without prescription. So, what are the benefits of over-the-counter medications? So, generally speaking, they're cheaper, they're more affordable, they have a lower risk for abuse, and for the most part, the reason why they are over-the-counter medication is because they're generally safe as long as they are taken appropriately. And again, lower cost. So, most of the time, over-the-counters are more affordable than specific, maybe brand name medications that are prescribed. Some potential problems include patient knowledge. Again, there's so many. So these medications are medications that the patient can just buy just because. But like with any other drug, right, this can have side effects. And if you're not taking it correctly, you can experience some side effects, right? Or you can have some adverse reactions. And so sometimes the lack of knowledge can be a problem. So an example that I gave my class, gosh, a long time ago. So my dad, he had good intentions. And so we had this dog. Apparently, we didn't realize it. I was so young at the time too. I wasn't even a nurse. I think, yeah, I wasn't even in nursing school when that happened. Well, anyway, so many years ago, my dad, we had a dog. So my dog was sick, and then the dog was vomiting blood. And so my dad was panicking, and out of the his love for that dog, he thought he was helping the dog because in the Philippines, or I don't know if it's in every other culture, but back at home, whenever somebody had a headache, you take aspirin, right? Somebody had some sort of aches and pains, you take aspirin. You have a fever, you take aspirin. So basically, my dad was using aspirin for every little thing. Well, with this specific dog, so I guess my dad put two and two together, and he thought, well, this dog is sick. Let me give him aspirin. Well, the dog was already having some bleeding. And so when he gave the dog more aspirin, right, it actually worsened the bleeding. Anyway, needless to say, the dog didn't make it. I mean, it is really sad. But my dad didn't know any better. And that can happen to people too. Can you imagine, right? If somebody's already have some ulcers and they don't know any better, and since aspirin is over the counter, they may be taking it and they're like, oh, I have a stomach ache, let me take aspirin. And so again, knowledge is a big factor, and we need to make sure that our patients are educated. Another issue that some patients may encounter is with self-medication. So again, everything is readily available for them, but then obviously they don't have the medical training to know that there are some medications that can have interactions. So sometimes if they take one supplement together with their other medication, it may cause them to have a bad reaction to it, or another thing is it may cause their other medication to not work properly. And as much as over-the-counter medications are considered quite safe in general, there's still a risk for overuse and abuse. Common medications that tend to be abused or overused, maybe some laxatives, the use of Benadryl just to help the people sleep. And so there are medications that are not used appropriately and they're still being abused even though they're over-the-counter medications. Examples of over-the-counter medications include Tylenol or acetaminophen, ibuprofen, aspirin, diphenhydramine, or Benadryl. Alternative therapies or herbal medicine. So another treatment or remedies that are available are your alternative therapies or herbal medicines or supplements. So alternative therapies include herbal medicine. Another alternative therapy is chiropractor, going to the chiropractor, getting some acupuncture, massage, I can't speak anymore, oh my gosh, reflexology, and other therapies that are usually not part of your traditional type of medicine, or that's whatever it is taught in Western medical schools. But for some patients, right, some patients, these are very they benefit so much from alternative therapy because sometimes the Western medicine is not enough. Sometimes taking supplements and herbal remedies are actually very helpful for whatever reason. Anyhow, so herbal medicine. So there's an advantage to herbal medicine. So one, it's readily available. It's over the counter, just like your over the counter drugs, and it comes from nature. So it's quite abundant if you think about it. Now, if it's often considered natural and preventative, but just so you know, just be very careful because the problem with herbal remedies is that they are not being monitored by the FDA. So sometimes some supplement companies may start having some claims that it has a certain amount of this active ingredient. Well, no one really checks for that. And so they may be getting away with selling you a bunch of fillers that are actually not working. Again, they're not closely monitored, just like your prescription or over-the-counter drugs. Some disadvantages are basically formulation. Again, they're not tightly regulated. Sometimes they can have multiple different active chemicals, and again, its strength is variable because no one regulates it. So you may have a prescription, you may have a herbal remedy bottle that maybe it's effective today, and then for your next order, right, it may not have that same effect because no one's regulating it. So they can choose to just put fillers in there. Although that being said, not all herbal medicine or herbal remedies or supplements are that way because some companies actually hire a third party to regulate them or to kind of audit and monitor the quality of their products. So not all of them are the same, but still keep that in mind, right? They're not really regulated by the FDA. Anyway, so self-medication can also happen, and with self-medication, the problem with that is drug interaction, especially if they don't report it to their provider. Because some patient may start taking herbal remedies without really telling their provider, and so if they get a new prescription, they don't know, right? It may have an interaction. Examples of herbal remedies include the St. John's wort. It's usually used for mood or depression. Black cohosh is used for hormonal imbalance for women. Ginkgo, they say it's good for memory and alertness. Red yeast rice is for cholesterol, and saw palmetto is actually used for BPH or benign prostatic hypertrophy. Now, going back, I just wanted to say that although it's not regulated by the FDA, I'm not sure about the rest, right? I have some patients who report relief of their symptoms using these remedies, but what I can tell you from my own experience, a couple of years ago, I've had hypertension, but also in addition to that, my cholesterol levels were really high. So, needless to say, every time I went to the doctor, they would, monitor my labs, and my cholesterol level was kind of going up. And so finally, my doctor was like, "Hey, you may want to consider putting you on a statin. A statin is a type of cholesterol medication." Well, anyway, so somebody mentioned to me about reduced rice, and you know what? I had nothing to lose at that point, and I just didn't want to be on a prescription medication. So I started taking reduced rice, and I think after 2 or 3 months of taking it consistently, I've had my blood work redrawn, and actually my cholesterol levels were actually normal. And so in my case, it was really effective. Now, will it be effective for other people? We'll see. I'm not 100% sure. But that's an example of a benefit of herbal medicine or supplements. Off-label uses. So this is basically when drugs are used for non-FDA approved indications. So let's say it is a medication for urination to help with urination, or maybe to help with get rid of extra fluids, right? Some medications that are diuretics, so medications that will make you urinate, are used for hormonal imbalance. So occasionally, although it's not primarily intended, right, for hormonal imbalance, they are prescribed for those reasons. So that's considered off-label. So if we're using it for something that's not necessarily their purpose, but it works, that's considered off-label use. And for the most part, drugs that are being used off-label initially, they tend to eventually become FDA approved, especially if it shows that through continuous use that one, they're effective, and second, that there's not a risk, or maybe the risk of toxicity is very little. Emergency preparedness. Let's talk about bioterrorism. What's bioterrorism? Well, it involves a deliberate, purposeful, right, release of bioweapons to cause death or disease in humans, animals, or plants. So they use biological weapons, which may be developed or also part of a government policy in biological warfare. It's usually by terrorist groups or criminals. Examples of those, and I'm sure you've heard it in the past, anthrax was used for bioterrorism, brucellosis, tularemia, those are examples of pathogens that they use as a bioweapon. So what is our role as healthcare workers? So one, our role is to really identify the attack. Of course, we're not going to be expert when it comes to that. But if there's anything out of the ordinary, we need to look at patterns, like the type of patients that we're seeing, their types of symptoms. And sometimes it may be hard, it may be hard to really identify it until after the fact, especially because many of these diseases actually have similarities. So their symptoms are very similar to your common illnesses, such as the flu and now COVID, right? So make sure you're thinking about that. Just pay attention to the trends. What's going on around you? What type of patients are you seeing? Is this patient very resistant to treatment, or are the doctors having a hard time figuring out what's going on with this patient? Now, once you identify that, our job is to start interventions, of course, with the doctor's orders, minimize panic to make sure that we keep our, well, first we need to stay calm, right? Although it's really scary, as providers, we sometimes have to have that poker face, right? We need to make sure that we're showing that we're calm so that we are able to calm down our patient. Then we need to minimize the panic, right? Provide reassurance. And then depending on what it is, right, our knowledge, obviously we have to know a little bit before we start educating the public. But once we know what's going on, or we have an idea of what's going on, our job is to educate the public and hopefully, right, work to prevent mass casualties. That's the main goal, right? As much as possible, we want to limit the damage from bioterrorism. Now, hopefully it doesn't happen in the near future, but it is something that we need to be aware of because it can be very scary and it can get a lot of people quite sick. All right, so drug abuse. So as we mentioned earlier, drugs can be abused, right? It doesn't always have to be the controlled substances. Now, the controlled substances are medications that are likely to be abused compared to the other medications, but it does not mean that people don't abuse over the counter. As mentioned to you guys earlier, some people can abuse over the counter. Even prescription medication, your regular prescription medication. Some patients abuse it in a way, let's say it's not prescribed to them, but they're still taking it, right? That's still considered drug abuse. Or maybe they're using it for different purposes, not for whatever it is prescribed for. Another common way of people abusing it is, let's say, a family member was prescribed maybe a pain medication, right? And then when the other family member has some sort of a pain or ache that they can't really manage, the person with the prescription sometimes shares that medication with that person. So again, that's a form of drug abuse. So basically, drug abuse happens when you are using or the patient is using the drug not appropriately, so not according to whatever it was ordered or prescribed. Terms that we want to understand and really differentiate is dependence versus addiction. Dependent is a physiological or psychological need for a drug. So that's just a general term. Now, there is physical dependence and psychological dependence. So, physical dependence, we tend to refer to it more as dependence. And so, physical dependence is the physiologic need for a drug to avoid physical withdrawal symptoms. So, example, a patient is on some medication, let's say a pain medication because of surgery, and they stop the medication and they start having signs and symptoms of withdrawal, like tachycardia or fast heart rate. Now, this patient, let's say, doesn't want to be off of that doesn't want to be on that medication, right? They want to stop that medication, but because they're experiencing some withdrawal symptoms, they have no other choice but to continue taking that medication. So that's physical dependence. So I've told previous students of mine about this story, but it was a story about my husband. And so my husband had back surgery. And after his back surgery, he was prescribed oxycodone. I think he was only on oxy for probably like 3 or 4 days. Well, after that, we followed the tapering schedule. So our his doctor actually said, okay, after that, taper down, which we did. So he slowly lowered the frequency and lowered the dose of the medication that he was taking. Once he was kind of really on the lower frequency, he was almost off. He started having withdrawal symptoms. So we went to the hospital. At first, we weren't 100% sure. I mean, I had an idea it was withdrawal, but at the same time, I was a little lost because he was only on it for a few days. And I think at the time, I didn't really realize that it doesn't matter how long you've been on that drug. Even if it's only been a day, a couple of hours, you can still experience withdrawal. I think for some reason in my head, I thought that you will only experience that if the patient was on that medication for like months or like a longer period of time. But anyway, so to find out he was having withdrawals, and it was what was really sad is people have biases. People kind of judge you, especially my husband at the time. He was in his 30s, so um, some staff members, you can just tell how they look at him and how they talk. They assumed, right, that he was addicted versus he was physically dependent. And I think that's really painful, especially if you're witnessing your loved one going through that. And then when you go to a doctor's office and ask them, can you refill this medication because he's having withdrawals? And so in their head, this patient is just pain med seeking, right? So there's some sort of a judgment already. So please take that in consideration, not because they're young, not because they look a certain way, right? That we're just going to assume that this person is addicted to this drug. You never know. This patient may be going through withdrawals because of physical dependence, not necessarily addiction or psychological dependence. Well, next that we're going to talk about is addiction, also known as psychological dependence. So this is basically the obsessive desire for the euphoric effects of a drug. So this is when a patient takes the drug because it makes them feel good. It makes them feel high, right? This is because of that different sense of like happiness or feel good effect of that medication. They're not physically dependent, right? It's just they want it. So in their head, it makes them feel good. So typically, it involves the recreational use of various drugs, such as your benzodiazepine, which is example is Xanax, opioids, which is hydrocodone, and amphetamines. So amphetamines, an example of that would be your Adderall. So psychological dependence or addiction is different, right? The purpose of the patient is different. So the reason why an addicted patient takes that medication is for that sensation of euphoria, right? But in physical dependence, they don't even want to take that medication. The problem is when they stop that medication, they start having withdrawal symptoms. Now, both can experience withdrawal symptoms, right? The one who's psychologically dependent, if they've been on a medication for a period of time, they can still experience withdrawal symptoms. So both can experience withdrawal symptoms. The main difference is the one that's physically dependent does not want to be on that drug. The one with psychological dependence or addiction, they want to be on that drug because they want to feel that high. All right, as nurses, when we're giving medications, right, we have a responsibility to the environment. We need to protect our environment. We have to follow the manufacturer guidelines, and the manufacturers also have to follow those guidelines to make sure to protect our environment and not create a lot of waste product. And also at the same time, you don't want any active medication dissipate in our soils and maybe our water system, right? You don't want that to contaminate our water, our soil, and all those things. So there are some regulations for manufacturers, and also as nurses, we have a role in that. We need to make sure that we're disposing our drugs, whether they're, once they're used or even just the containers, we need to make sure we're storing them appropriately and disposing them appropriately. If you're in the hospital setting, you have your blue bins, right? That's usually where you dispose excess medication that wasn't used. There's also a special place where we can dispose of controlled substances or opioids. And so be aware of that. Make sure you're trying your best to be at least to do your best to protect the environment. Now it's here again, right? You've seen it so many times, and so the main thing is, right, you need to memorize this. So we used to have the 6 rights in this program. Now we're observing the 8 rights of medication administration. So what are they? Right patient, right drug, right dose, right route, right time and frequency, right documentation, and the 2 additional ones is the right reason and right response. So please know this. There are different routes of medication administration. So when we say routes, it's basically a way to give that medication. So what pathway did we take for us to give that medication? So you have the enteral route, which basically involves ingesting. So it's through the digestive system. So example of that is your oral medications or any medication that can go through a gastric tube. So it goes through the digestive system. There's advantages and disadvantages. Well, the advantages for the most part, PO medications are quite tolerable. There's lesser chances of toxicity unlike other forms. The disadvantages is sometimes the effectiveness, the onset, right, can be a little slower because again it has to go through the first pass effect, which we're going to learn in a little bit. But basically, even if let's say you gave 30 milligrams of a drug, once it's in the system, once it gets digested, it's probably just half of it that's going to be an active form that's going to be useful for the patient. So not all of it becomes an active drug that's actually going to cause some effect on that patient. Now you have parenteral. So parenteral meaning it does not go through the GI system. So other than something taking it orally, this would be your injection. So different forms of injections including intravenously, which is through the IV or through the vein. You have intramuscular, which is an injection to the muscle tissue. And you have subcutaneous, which is an injection to the fat tissue. Other route is topical. So topical is really when the medication is delivered directly to the affected area. So that's the area where we want it to work. And so examples of topical are the topical antibiotics, so antibiotic ointments, creams. You have the patches, so that's topical. Rectal route, so that can be topical as well. Again, it doesn't go all the way to the digestive system. Instead, it gets absorbed in that local area. Another form of topical medication is through inhalation. So if you give somebody nebulizer treatment, that's still considered topical. So in inhalation, this is the medication is inhaled directly to deliver it to the lung tissues. All right, first pass effect. I mentioned that before. So what does that mean? So first pass effect is the initial metabolism in the liver of a drug absorbed from the GI tract before the drug reaches systemic circulation through the bloodstream. The problem with this is that it reduces bioavailability or extent of drug absorption. So like I said before, right, if a drug goes through the first pass effect, the medication, the concentration, basically what's available for the patient or the body to use is going to be decreased in comparison to the injections or maybe the intravenous or intramuscular route. So first pass route, so hepatic arterial, oral, portal venous, and rectal. The most common one is oral. We rarely see the hepatic arterial. That's usually if it's directly given through that or portal vein. Oral, next common one is the rectal. So that's probably what you're going to see in the clinical setting, oral or rectal medication. So part of the rectal medications, although it's still considered topical, part of it can still be absorbed and be part of that first pass effect. All other routes bypass the first pass effect, meaning your IV, your injections, your intramuscular injection, and your subcutaneous injections. All right, let's talk about the process of medication administration. So what is the process? What do you do when you're giving medication? So pretty soon, maybe in the next couple of weeks, you may start giving medications to your patient. So how do you do it? Well, one, it's very important to do hand hygiene. Make sure that your hands are clean. So sanitizer before you go in the room, before you prepare the medication, and so on. So hand hygiene is very important. So this is not necessarily in order, but these are the things that needs to happen. You need to calculate the drug. So part of your job as a nurse is to make sure that you're giving the correct dose, the correct amount of drug. Be punctual. Again, it needs to be given at the right time, right? At the right frequency. So if you don't give it on time, right, it can affect the effectiveness of that medication. Can you imagine an antibiotic? You want the antibiotic levels to stay consistent, but let's say you missed and you gave it later, that level in the patient's blood will go down. And sometimes what happens with that bacteria, right? Sometimes that's when the bacteria can start developing some resistance or even before resistance. It just gives the bacteria an opportunity to grow even more, multiply even more, right? So you want to make sure that you're giving it on time. Obtain the drugs for one patient at a time. So when you're taking the medication, don't take medication, all the medications for patient A, and then in another pocket you have medications for patient B, and then on the other pocket you have medications for patient C. Because what if you can't remember where did you put what medication, who it belongs to, right? That actually can increase your chances of doing or committing a medication error. So please don't do that. Obtain the drugs for one patient at a time. And 3 checks. Remember what I told you guys? As you're pulling the medication, as you're preparing it, and right before you're giving that medication, you need to be double checking, triple checking everything. Check for expiration. That's very important because, again, if you give an expired medication, you can't really guarantee that that medication is going to be stable and it's going to have the same effectiveness or efficacy as if it was compared to if it was not expired. So make sure that the medication that you're giving your patient is not expired. So all medications should have labels with expiration date. If it doesn't, question it, return it, get another one with an expiration date. And again, ensure compatibility. Check for drug interactions, and that's why you also have your drug handbook. If you know that your patient is on medications A, B, and C, you have to kind of know all of the medications that your patient is taking so that you can check for compatibility. Because again, there are medications that can't be given together. And before you administer the medication, make sure you're checking the patient identifiers. And if it's available, use a scanner. One thing that I keep on emphasizing, educate your patient. They need to know what you're giving, why you're giving, what are the things to expect, and maybe side effects that they need to report if they experience it. Now, open the medication at bedside. I know some people have a tendency to prepare the medication before they go to the bedside. The problem with that is once you open the medication, sometimes the patient may just refuse it right then and then, right? So at least if you didn't open the medication, you're not wasting the medication. And also, the problem with opening the medication and preparing it outside the patient room, now you have to label it, right? There's a little bit more chance of maybe getting the wrong medication, getting confused, especially if it's all like maybe all the medications are in a medication cup, right? You don't even know which one is which anymore, right? And so it is better to actually open and prepare the medication at bedside as much as possible. Now, if the patient refuses, first we have to educate the patient, because most of the time the reason why the patients refuse is because they don't really understand the importance of that medication. They don't know what to expect. And so really put yourself in their shoes. Would you want to take something that you really don't know about? Like you don't know how it's going to affect you, and you're scared that it may give you certain side effects. So think about that. So if a patient is refusing, give them patient education. Ask them what's going on. What's the reason why you don't want to take that medication? And then talk to them about the importance of that drug, right? For the most part, once you reassure them and you give them all that education that they need, most patients, they'll realize how important it is to take that medication, and they will take it. Now, if they still continue to refuse, then you need to return the drug if you didn't open it, right? If you didn't touch it, patient, if it's something that's sealed, you can return it. Or if it's already open or the patient already touched it, obviously you have to get rid of that. A very important part of this is that you have to document the refusal and also, the reason why, what medication, right? And also you have to notify the provider, because you don't want that the provider will maybe check the patient the following day or maybe in a couple of days. And let's say it's a blood pressure medication, the patient keeps on refusing, blood pressure continues to be up. Now the doctor or provider rounds the following day and it's like, oh, well, this medication is not working. Let me add another drug or let me increase the dose, right? Without realizing that the reason why it's still high is because the patient wasn't even taking the medication to begin with. And so it is very important to keep your provider in the loop, because the last thing you want is for them to make adjustments when it wasn't really necessary, right? And so, and maybe there are other routes, there are other alternatives for that. Maybe there's other treatments that maybe the patient would rather have, right? So again, notify the provider. Now, after you give a medication, please do not leave the patient immediately by themselves after you give the medication. There are patients, they can be tricky. Not that it's intentional. Sometimes they will purposely take it and hide it and spit it out once you're gone. And there are some patients who you think they swallowed it and maybe they have a hard time swallowing and they start coughing and maybe they vomit. And so now your pill is out, right? So they end up not taking that medication. So make sure that you don't leave the room immediately. And at the same time, other than making sure that the patient took the medication, you also want to make sure that they're not going to experience any adverse reaction from it, especially if it's a new medication. So if it's an oral medication or PO medication, wait until the patient takes the medication. Like you have to kind of see them swallow that medication. Anyway, after you administer that medication, you have to go back and evaluate the patient. Like I always tell you guys, evaluate for effectiveness and evaluate if it's, patient is responding, right? Or is the patient having an adverse reaction to that treatment? Also, don't ever forget to observe your 8 rights. And don't forget hand hygiene. So again, check your order and check your chart. Make sure you verify your 8 rights. You examine the patient. So before you even give a medication to your patient, you need to know what's going on. You have to have some sort of an idea of what's going on with your patient, how's their blood pressure, if it's something that's going to affect their blood pressure, and so on. So you need some baseline information before you even give any medication. And so examine your patient. As you're examining, right, while you're in the patient room, let them know that you're going to give them their medication. If you don't know the medication, which is expected from you guys, right, because you guys are nursing students, look up the medication. Do the med math if needed and obtain the supplies. And then once you're ready, right, you did your med math, you got all your supplies, you told your patient already, you examine your patient, pull the medication, check, verify, make sure everything is correct, right? If you don't have access to the Pyxis or Omnicell, have your nurse or your nursing instructor help you with that. And then once you gathered everything, your supply, your medication, you talk about, the medication with your instructor. Then you go back to the patient room, make sure you knock and explain what you're doing. As you're doing it, you can start talking to your patient. Okay, this medication, this is for this purpose, and so on. Anyhow, explain what you're doing to your patient. Before you even give anything, right, check patient identifiers and allergies. Check their name and date of birth. Not only ask them, but look at the armband. In some facilities, you'll have the scanners. So scan them and ask them to verify, especially if they're verbal. And in addition to that, make sure you're checking for allergies. And next is really educating your patient about the medication that they're taking. Very important part of your patient education is letting them know what's the name of the medication, what is the purpose, the side effects. Answer some questions that they may have. Add additional information that may be important for that specific drug. Example, blood pressure medication, some of them you have to check the heart rate and the blood pressure. And those are things that you may want to tell your patients, because at the end of the day, right, your patients will be there temporarily, but they'll eventually, hopefully, go home, right? And so who's going to take care of them, right? Their family members, or sometimes they have to take care of themselves. So they have to know what medications they're taking because they're going home with them for the most part, right? You need to educate your patients and their families because, again, if they can't take care of themselves, they may end up needing help from their family members. Anyhow, so after that, make sure that you're scanning each medication as you're preparing them. So scan them before you open it, scan it, right? Make sure also that that's the right medication that you're opening. Again, check, verify that all the information, all your 8 rights are correct. And right before administering the medication, check and verify everything again. Make sure it's correct. Then administer the medication and then document. Document that you did, because if you didn't document, right, it didn't happen. After that, right, after you're done, you made sure that the patient took the medication, you have to go back. Depending on what medication it is, you need to go back within the probably 30 minutes, maybe an hour, depending on the right response. So anyway, so please use this to guide you when